Hi, I'm Dr. Behnam, hair transplant specialist in Los Angeles, California. And today I'll be talking about non-surgical options for hair restoration, which basically means medical management, which include oral tablets, topical medications, new innovative topical medications, and new innovative stem cell injectables for hair loss treatments. So the options are really divided into a few things. Number one, topical medications. 2, oral medications. 3, injectables, and then good nutrition. And I'm also going to be sending you a sheet of paper through text or email that basically just highlights all these important things. But this video is designed to go through all of these in explicit detail. So let's start with the first thing on the list, which is a topical medication to help out with the hair loss. So what is this topical medication? This topical has 3 ingredients in it. For some people it may change a bit, but mainly 3 ingredients. Rogaine, also known as Minoxidil, 8%, Finasteride, also known as Propecia, 0.25%, and retinoic acid. So how did we come up with this formula, and who makes it, and how is this compounded? Well, this came off of an idea about a few years ago that a lot of patients were taking oral Finasteride, oral Propecia. However, according to clinical studies, 3 up to 8% of the patients taking Finasteride get sexual side effects, erectile dysfunction, like lack of erection in the morning, lack of hardening, decreased libido. So there had to be a better option, and there were a lot of studies in the clinical literature that were popping up about taking the Propecia and making it into a topical solution. We found a compounding pharmacy, and there are 2 pharmacies that help out with us, that they actually make this into a topical solution, right? So you can apply it topically. Why and what's the benefit? Well, the benefit is that you don't have to take it orally, right? Because orally goes to all your organs, increases systemic side effects. So when you apply it topically, you apply it where you really need it, and systemic absorption is slightly less, so you don't get the side effects as much. And that's really the benefit, to really minimize the side effects. And we feel that if you because of the hairs right on your scalp, we really apply it and actually get good results. So we approached different compounding pharmacies. We found the one that could add the Propecia at the highest level that is in the clinical literature. However, we could even change that because it's specially compounded medications, and we could change it to the level of Propecia that you want. Okay, so this is how it comes in, right? So just a basically bottle. It has Finasteride in it, and since this is compounded, so we could actually change the ingredient of what's in here. We said, why don't we just also add Minoxidil? Now, standard Minoxidil that you get over the counter has 5%. For women it's 2%, but it has 5%. We said, how about we up it to 8%, so it's stronger. So we made it such that this also has Rogaine 8%. Then a lot of clinical literatures talked about adding retinoic acid to the Minoxidil to increase penetration and results. So we also added retinoic acid in this. So it has Finasteride, Minoxidil, as well as Retinol. You apply it twice a day. So it does not mean that absolutely gets rid of the side effects, right? However, it just reduces the rate. So for Finasteride, you still need to be aware of sexual side effects, erectile dysfunction, like lack of erection in the morning, lack of hardening, decreased libido. For Minoxidil, the side effects are basically just palpitation or lightheadedness, always really rare. And the retinoic acid, it just increases sun sensitivity. So if you're going to go out on the beach one day or hike, either don't apply it in the morning or just wear a hat. You could wash it after 2 hours if necessary. So how to take this in order to really minimize side effects, and by the way, all this information are always included in the pamphlets and handouts that accompany the topical, right? The way you do it, you taper it over 1 month period. So the first week you take it 3 nights, you apply 3 nights. So Monday night, Wednesday night, Friday nights. The second week you apply it every night. The third week you apply it every night and 3 mornings, Monday, Wednesday, Friday. And then by the fourth week, every night, every morning, and you just continuously go every night, every morning, unless if you have any side effects, which then you stop. For Finasteride, one of the things you should be aware of is depressed mood or brain fog. So if you get any of those, you also have to stop it as well. But those are specific things that you're going to contact with the office and we'll tell you about it, as also written in the pamphlets as well. Okay, so this is the first one on the list. Is topical. You try for 6 months and basically you gauge it, and you obviously want to take pictures to make sure you know it is helping out, and that's very, very important. One of the things I feel that really helps out with the use of topical is the use of derma rollers. So what are derma rollers, right? They basically have a bunch of little spikes, and what you do, you roll it on your scalp, and it basically does 2 things. First of all, it opens the pores, so when you apply the medication afterwards, it penetrates better. Second, it causes growth factor release, and that stimulates the hair regrowth. So you do this about twice a week for 3 minutes at a time, and you want to basically do it crosswise. So I would do maybe Monday or Friday for 3 minutes in that region. Now, if you have a lot of hair, or coarse hair, or curly hair, or long hair, well, rather than getting a derma roller, you get a derma stamp. And you can get it from off of Amazon, and it works pretty well in achieving better results. Now, there are a lot of YouTube videos of how to use it, as I see some of the patients are bleeding. No, this is supposed to be gentle, okay? And I recommend 0.25 millimeter, which reflects basically the needle size. So now we're going to just watch a few of the patient testimonials, people that have used this topical medication. Now, this topical medication also comes by the name of Happy Head, so some people will be talking about Happy Head. And after these testimonials, right, we're going to then talk about PRP and stem cell and what they are.
Hey guys, so I've been trying every product, I guess, for the last 2 years now, and I finally started using the topical Happy Head product 2 months ago. As you can see, I was having a little bit of thinness in front. This is just 2 months on the product so far. I'm really excited about my results. I'm excited to see for the months to come. My confidence has gone up a lot. I'm also just less anxious. This was a big anxiety trigger for me, and not having that anymore on my plate has been a big relief.
Hey, what's up guys? My name is Matt. I've been using the topical solution for about a year or 2 now. I would highly recommend it to anyone else that was having issues with their hair loss or even like confidence issues. Ever since I started using it, I haven't even been worried about my hair loss or even self-confidence. I've been very confident in just going out and talking to people. I mean, if you can see from before to compare to after, it's real hair, and it's all just from putting stuff in once or twice per day.
I started taking Happy Head. It's been the easy topical solution. I've been much more confident and happy. I've really just stopped worrying about how my hair and head look. I feel just much more confident and better about every day.
You can see the result very fast. You can see the result in the 3 to 6 months that you cannot see with any other product. So definitely I recommend, and try it.
Before I had a significant decrease in my hairline, and now it's just absolutely amazing to see what it's done to fill it out and just give it more volume.
That's really me. See how far back it went. This is now, I started noticing results after about 2 months.
It's given me a lot of confidence. It's given me a lot more comfort with who I am, and I couldn't recommend it to my friends and family more.
I am a huge fan of the hair growth that's been going on through using the topical solution, and you know, from here to way more fluff and way more full.
This topical solution is like a magic bullet, if you will, to preventing hair loss and actually getting some of the hair back that you lost before. So 2 thumbs up, love it.
Go. Really having a hard time. Today, as you can see, full set of hair, very happy with the results.
So this concludes basically topical medication for hair loss. Now let's switch over to injectables, and they are PRP and PRP plus stem cell, true stem cells that come from a fetal placenta. And Typically, we mix it with your own PRP and we inject it. So what are stem cells that come from fetal placenta and why is it important? Now, you also have some stem cells in your body, bone marrow, the fat tissue, etc. However, those are aged, and as they age, their effectiveness decreases. When it comes from a fetal placenta, it's brand new. So when a baby is born, two things come out. One, the baby. The second, the placenta. The placenta cord has these stem cells, and there are companies that extract these stem cells. And just to let you know, these are healthy moms, healthy baby. They're tested for pathogens. The stem cells themselves are then sent, a sample of it is sent to 3 different independent company labs that test them for pathogen, and then they arrive here. Basically, they're frozen at specific degree of Celsius. We have special freezers that hold them, and they come with the laboratories as well, so you're able to visually see it. And then once we are doing the PRP, we have it thaw it in front of you, and then we mix it and we inject it. And those stem cells basically cause regrowth of the hair that it lasts about 9 months to 12 months. So neither the PRP or the PRP plus stem cell is permanent. The key is to basically give you this growth and then you to use other things to actually maintain the results. So the questions people ask me are, how often do I do PRP? And if I add stem cell to it, how often do I have to do it? Well, this is a consensus. If you just do PRP by itself, you initially have to do it twice, like first month or 6 weeks and 6 weeks after, and then maybe 7 to 12 months afterwards for upkeep, if you don't do anything else. When you do stem cell plus PRP, you do it once, and then maybe 9 to 12 months. But again, it varies for everybody and everybody's different. So some people, we're going to see some testimonials that, they by 2 years, they still have great results. But for us, the key is not for you to keep doing these things. However, to do it and then use other stuff like topical or oral medications to maintain the result. Now we're going to watch some testimonials for PRP plus stem cell for both men and women.
And the stem cells did magic on me, so I couldn't be happier with it. If you're feeling any, if you're feeling self-conscious about your hair loss, or you're dealing with it for whatever reason you may be dealing with it, this could be the answer to help you fix that. Because I look at this photo and I don't even see myself. This is pretty scary to see. I don't have to feel as self-conscious if I wake up, I have no hat on, I'm around people. Because that was definitely real life for me, where I was like, if I wake up and I was looking like how I looked a couple of years ago after the mold affected my hair loss, then I'd feel super self-conscious. I'd make sure I get a hat on immediately. But now I could kind of go throughout my day without having to over-stress about that or over-focus about that.
I started noticing probably like 3 to 4 months after, mostly in here it started to come back, and then there was this large patch in here that started to grow more like 4 or 5 month mark. But then when I mashed it up between the before and after pictures, that's when I was like, wow, that's a big difference.
So we injected all along here. Again, all this hair came back. We injected all along the hairline here, and also right at this corner right here.
I'm super pleased. I'm happy. I hope it stays like this. I will do it again.
Okay. Oh, what do you think about your hair?
I like it a lot. I couldn't believe how much improvement I've had.
So are you happy with the results?
Yes.
Do you see visible hair growth on your scalp?
Yes.
Let's take a look at the hair. Let's see. Bring the hair all the way down. So this is his actual hair. We mainly focus in the crown area. And I'm going to use a comb literally just to move around. Look, it's his natural hair. There's no hair transplants and there's no hair grafts. What the stem cell did is it caused his natural hair basically to grow out. I mean, this is really phenomenal. Like, this was an area till a few months ago. I mean, there was hair, but really not that much. You were able to see a large area of it basically being thinned out. And look at it, it's pretty much all covered, and pretty much covered with his own natural hair.
The results have been really good, particularly in the crown. That's seen phenomenal results, and then even in the front, there's a large area of the scalp that was just exposed before, and it's started to grow back in. So
great,
pretty awesome result.
So this is the front. We're able to see the scalp very easily, but now there's really like a lot of hair growth. And if you look closely, there's a lot of like small hairs basically growing right there as well.
And 2 years later, honestly, the results are still there. I still see them. And the areas that I was very concerned with 2 years ago, it's still thicker, I still see results. I was only told that it might have lasted about a year, but now that it's lasted almost 2 years, it's very exciting. And it was very quick, easy, and I would definitely recommend it.
I ended up finding Dr. Ben, and we tried the stem cells, and surprise, surprise, it actually worked. So it's been a 30-year journey, and I never thought I actually would think of trying to regrow hair at this point. I'm very satisfied with the results.
4 months after his stem cell, so this is how he looks like right now. So again, so this is before stem cell, and this is after stem cell. So again, so this is another testimonial of one of our patients with just stem cells in the front and using the topical finasteride in the back. He's quite excited. He says that he feels a lot younger, he feels his age, and he feels a lot more confident when he's talking to his own clients basically at work.
I was feeling hopeless, and this has been giving me great results. Like, even when I look in the mirror and I'm getting my hair ready, I don't feel like I have to like camouflage as much as I used to. It's given me a lot of hope and feeling like it's only going to get better, because like you said, it's only 2 months. So I highly recommend this for anybody who has tried everything else.
So this was my hair before. If you can see, I was losing some hair mainly in the front of my head. I have a lot of hair in the front and also coming in on the sides quite nicely. I've actually gone to 4 different doctors and had my procedure done 4 different times. And the difference with Dr. Behnam is he's so thorough and he keeps up on his research that he's doing the latest cutting edge. I know he's using, I think, a lot more product, and you're getting a lot more for your money. And that's the key, because if you're only doing a few shots here and there, it's really not going to be helpful, and it's a waste of time.
So this is a young gentleman, and he couldn't believe the results. It's almost been a year and 10 months after, and he's still doing really well, and he's not taking any medication. He's not on oral finasteride, he's not on oral minoxidil, he's not using topical minoxidil, and he's not using topical finasteride. In his case, the stem cell with PRP worked very effectively.
So what is PRP? It stands for platelet-rich plasma. And what this is basically we take your own blood and we centrifuge it to take the growth factors out and we re-inject it. These growth factors can stimulate hair follicle and hair growth. Is this permanent? No. Typically with PRP, right, it has to be done twice, right, done in 1 or 2 months, and then maybe every 6 to 9 months or 6 months to 1 year. So if you tried PRP in the past and it wasn't not successful, I would advise to just reapproach it again with the newer thinking and new ideas. Dr. Ben, my brother, the dermatologist in the office, he's the one that does all of the PRPs, and you could definitely have a consultation with him in person or virtual. I'm going to now watch a few of the testimonials of people that had PRPs to see what they say about it.
And this is just purely PRP, and I just want to show that about 3 to 4 months later, this is the results you're gonna get. This is basically his own hair, and what you see is basically all this area where we've treated here, basically at the corners, all the way across through here and all the way down here. These are all his own hair that has just thickened up and basically grown out.
I was also experiencing like hair loss, especially on the part. And Dr. Ben suggested that I do PRP, and yeah, I got great results with that too.
So now that we have talked about so far topical, the PRP plus stem cell, now let's talk about oral medications, right? So oral medications, as discussed before, is propicia for men. However, 3 to 8% of patients can get sexual side effects, brain fog, or depressed mood. You really don't prescribe that as much, but if this is something that you like, please contact the office. I will be more than happy to do it. For women, it's either spironolactone, right? However, this does require blood draws, and please contact us for that. Or Minoxidil oral version, and please contact us for that. Now I'm going to go ahead to vitamins, right, that you could do to actually enhance your hair growth. And all these complement one another. So let's say you do the PRP plus stem cells, the topical. Good nutrition is very important. Now I have a video that's already on YouTube, and the title is Reversible Causes of Hair Loss, right, based on 20,000 patients. And it's a 17-minute video that talks about reversible causes of hair loss, what you do on a day-to-day basis. I would recommend searching for it and actually watching it, which is very important. But very quickly, I'm going to just discuss few things which I believe are very important in maintaining your hair. Number one, gelatin. Remember, your hair is all protein. Gelatins are basically, as you know, are animal based, but they're also fish gelatins that are available as well. The gelatin that I like, you could get on Amazon, and it's the brand name is 21st Century Gelatin, 600 milligrams. It's cheap. It's only $4 a month at the making of this video. And you take 1 tablet twice a day. Or you could get fish gelatin and take 1 tablet twice a day, and that's okay. The key is proteins. Protein is important. You could supplement with the whey protein, right? But it must be concentrated. So let me just talk about what whey protein really is. You have milk, and you convert it to yogurt. The byproduct is whey protein. That natural pure byproduct is the concentrate. However, a lot of companies that make whey protein for muscle builders add branched-chain amino acids like leucine, isoleucine, valine, and now that is termed isolate. Isolate, because it has those branched-chain amino acids, increase your DHT level, cause hair loss. So if you take protein, you want to take protein to supplement, increase protein in your system, make sure it's whey protein concentrate. Good. If you do take whey protein, I will also do the gelatin as well. I think it's a very good source of protein, and over the past few years I've used it. That brand specifically, patients like it a lot. The other thing is vitamin D. I like it. 2,000 international units a day. You don't need blood work for that. And I like the same brand, 21st Century, because it's cheap. The other thing is Biotin. Biotin, 5,000 micrograms, mcg a day. Is good for your hair, right? I know there are a lot of brands out there that have 10,000. I will not do 10,000. Just do 5,000 is sufficient. So what do I like? I like gelatin, vitamin D, and biotin. And if you could add whey protein to it, that's fine. Just make sure it's concentrate. In addition to that, I like biotin shampoos, right? You could, on Amazon, there are a few of them out there, right? They're like $14. I would do that. However, not necessarily you have to shampoo your hair on a daily basis. Twice a week is just fine. So let's recap. So you're not a transplant candidate, you need to maintain what you have, because if you lose it, you can't really get it back. Options, topical solution twice a day. We've talked about the one that has topical finasteride, will gain 8% retinoic acid. You get it from our office or from happyhead.com. The PRP or PRP plus stem cell, I've already reviewed how we are different, and Dr. Ben does all those. You could contact the office, right, at 310-315-4989. We're listed below, so you could make an appointment with him. Oral medications like Finasteride, Aldactone, or Minoxidil, if you like to go down that route. And then specific vitamins like gelatin twice a day, biotin once a day, vitamin D once a day, and good nutritional proteins, in addition to just minimizing the shampoo and using biotin shampoo. So now I want to introduce Dr. Ben Behnam, my brother and also the dermatologist in the office, who is really the pioneer of stem cell for hair loss. What is your approach to using stem cell with PRP for hair loss, and how do you get good results?
So back in 2010, when we started doing PRP, at that time we really didn't know much how PRP really worked for the hair, and really didn't know the right protocol. So the past many years, we've experimented with doing the PRP many different ways, and we really learned the best way of doing PRP in order to achieve the best results. So for example, years ago, we used to start basically with taking like 5 ml of blood or 10 ml, and that's what like a lot of doctors currently do. And actually I see Instagram posts every day where doctors just basically, they have a small tube of blood and they're doing PRP. That's absolutely wrong. That will never work. We did that for many years. So now what we do, we actually use a bone marrow kit that allows us to draw 60 ml of blood. That's literally 10 times more in one session. Also, we used to do a single basically spin PRP. Now we do a double spin PRP, which means we spin it once and we take the good part out and we spin it again in order to get much better platelets and growth factors to purify it better. Also, typically we just used to spin it for like a couple minutes here for each spin, but now we literally spend for almost 45 minutes to an hour, collectively both spans, and we believe it really makes a difference. I mean, we've done our own set of patients using 2 different methods with different timing, and we realized that when you spend it longer, just patients get better results. In addition, we actually add a specific salt to it to activate it, and the most important thing is the way you inject it. So what we do, we draw 60 ml of blood using this special bone marrow kit, spin it for almost 45 minutes to an hour. We add an activator to it. So without the activator, PRP is not going to get activated. And then we inject it. So the method of injection really makes a difference. It literally takes me about 15 to 20 minutes to inject every patient, and I really take my time to inject it. The key is to inject it at a very specific level in the skin. The hair follicles are literally right between what we call the epidermis and right upper fat. That's where they sit. And what I see every day on Instagram is basically where practitioners are injecting, they put the needle all the way into the skin and take a photo of it. That's the wrong way to inject PRP. It's not gonna work. You're missing basically the areas where the hair follicles are. You're overshooting the hair follicles. So what it is, you literally have to be very superficial. Only the tip of your needle has to be within the skin. You have to feel that pressure as you're pushing in on the needle. So if you inject the PRP and it's really going in very easily, you're not in the right plane actually. You have to kind of come up and basically readjust and inject again. And this is why it really takes almost 15-20 minutes to inject. And you're heading it then at the right place for the hair follicles, and that's how you're gonna get the best results. You really gotta put in the time to see the good results. We also have to do derma rolling after. The derma roll after the PRP is very important. And all of these steps that I've explained are really critical in achieving the best results. And this is something that we've learned through just experimenting in our clinic over the many years. And in our basic clinic, we really just do PRP twice, and patients see really great results. Whereas, other places they have to do it 4 times, they're still not seeing the results. PRP is not for everyone, and not everyone's going to see the best results. That's why in 2016, 2017, we kind of introduced the stem cell. So when we started to do stem cell, and I remember specifically calling out other clinics and talking to stem cell manufacturers, nobody had ever done it for hair, as far as I know, and nobody even had any before and after photos. We started to mix the PRP with stem cells back in 2016, 2017, and we initially first started to do the 5 million cells, and then the 10 million cells, and then 15 million cells, and then 20 million cells, and then we finally got to the 30 million cells, and now some patients were doing with 60 million cells. And initially when we started out, and if you look at some of the early videos, we were doing patients that basically were really completely bald and kind of hitting it all over the place. But we've learned a lot. One of the first before and after photos that I saw that stem cell company used was our photos that basically we did stem cells back in 2016, 2017. What stem cell does, stem cell is not FDA approved, but we followed based upon FDA protocols. What it does is kind of like PRP on crack. It kind of boosts the hair basically to grow out. First of all, I think better than PRP, you only need 1 session, and the results could potentially last longer than PRP, could last anywhere from a year to like 18 to 22 months, and we have videos of basically documenting patients where it lasted basically that long, almost 2 years. And it kind of like
PRP on crown, it really boosts the hair basically to grow out. But you know, you have to know how to use it. You know, we obviously mix it with our own PRP, 60 ml PRPs. In addition, you don't want to spread it all over the scalp. You really want to pick a localized area and basically hit that area really hard. And also in our clinic, when patients come for PRP or stem cell evaluation, we really look with the magnifier to see if they have pitch fuzz hair there. I mean, if you have no hair there and the density is really low, there's no point of doing it. So you have to have the density along with the miniaturized hair for PRP or stem cell for it to work. They're using the laughing gas throughout the entire procedure, especially when I'm doing the derma rolling. So again, overall, it gives patient a very comfortable, it just makes them very comfortable and makes them relaxed. And honestly, I think that's one of the key of achieving great results with both PRP and stem cells.
Perfect, wonderful. Well, again, Dr. Ben does a tremendous amount of PRP and stem cells. He's been doing it for the past many years. And if you're interested, definitely please call the office to schedule a consultation directly with Dr. Ben. Thanks so much.
Thank you so much.